We going? That's it?
Yeah, 6 o'clock.
All right. Welcome to Voces y Visiones episode 2. Oh my God, I'm so excited for this. So as you know, it's a really big topic, really big discussion. And I just want to start before we get into anything, if y'all could please do us a favor and fill out this survey that we're just popping up right now. And you could just leave it in the comments, like everybody on Facebook or whatever. Just leave it in the comments. So we're gonna do it's just four questions. Just put like answer 1, answer 2, answer 3, whatever. So we're just gonna take just a little bit of time just to go through this survey real quick. And it's like yes or no. Yes or no. There's one that has a maybe on it. All right. So real quick, question 1. Question 1. Okay, like I said, A1, A2, A3, A4. So just let us know which question you're answering. You could just pretty much go in order. But this, any answers is going to be a big help to let us know if this is working. What do y'all think about it? If there's any kind of impact, any of that. So your input is like super important. So question 1, let's see. How did you find out about Voces y Visiones? I wish I could read that good in Spanish. I could understand it clearly though. How did you find out about Voces y Visiones? 1, Facebook. 2, Instagram. 3, YouTube. 4, text. 5, Twitter. So comment, leave your answer on there. How did you find out about this? How did you find out about Voces y Visiones? So just leave your answer on there. Like if it's Facebook, put A1. If it's Instagram, A2, and so on. So just comment real quick just to that one. And then we're about to switch to question 2. How did you find out about voices? Okay. Question 2. To which age group do you belong? 18 to 25, 25 to 40, 40 to 65, 65 and older. Comment, let us know. Just put whichever one it is. Put A2 and then your number. A2 and then your answer. So just let us know what your age range is. Just put that right there, like right after. And then we'll go on to question 3. That's only for a question, real quick. All right, question 3. From where are you joining us? I know where a lot of them are. Rochester, Minnesota, Midwest, Texas, California, or other location. Like I said, just leave it in the comments right there on the live. Leave it on Facebook. Just put answer 3. Just put A3, and then your answer. 1, 2, 3, 4, 5, 6, whatever. So yeah, just let us know where you're at, where you're joining us. We want to know how much of an impact, like how much we're on the map already, and how many of our people are all tuned in. So yeah, now the last one, question 4, is: are you getting the COVID-19 vaccine when available to you? 1, 2, or 3, yes, no, or maybe. So that one, you just put A4 and then your number. A4 and then your number. So, just let us know. Right now, as of right now, what do you think? Are you getting it? Yeah. So just let us know. Comment, and then we'll get into it. Okay. Oh, that lighting's good. All right. So. Here we go. I wish I could come in and do like jumping jacks. I'm telling you, next time. All right. So, welcome to Voces y Visiones, episode 2. Is the vaccine the answer to the pandemic? Lost hope and uncertainty. With Dr. Suarez and Dr. Medina-Inojosa. So, okay, real quick before we get into details about our guest speakers and everything, we just want to say thank you right off top for everybody who's making this happen. Thank you to CMAC for their Arts and Cultural Heritage Grant. Thank you to ACLA for their collaboration on this. Thank you to both doctors for joining us, giving us their time. Thank you to all the family and friends for tuning in. Everybody that's making this possible. Thank you to Alexis Rivera, my cousin. Thank you so much for setting all this up, the website, social media, everything. Thank you to Erica Tovar for sharing that and spreading it on our Arobe page. And you already know what the Arobe page is. For those who don't, look it up. So thank you to everybody who's making this happen. Thank you to my brother and my son for being quiet while we film this. Yeah, so anyway, let's get into it. What is Voces y Visiones? Voces y Visiones is a show where we use art to initiate discussion, discourse, and inform, engage, and dive into topics surrounding issues that affect our community as Latinos, as Chicanos, Chicanas, Chicanx. So this is where we dive into the issues. But we use art as the catalyst for these conversations, right? And then we invite professionals in their field, and we give everybody a platform to discuss and exchange ideas and information. Okay, and in hopes of building bridges of understanding. So that's what Voces y Visiones is. This is episode 2. We're on it. Guidelines. Really, it's just like, if you have a genuine concern, genuine question, or whatever, just wait until the Q&A section hits. Once the Q&A hits, leave your comments, leave your questions in the bottom, and we'll try to get to all of them. I'll have my phone on here. I have it ready. Leave your questions for the doctors, for us, for me, for anybody. But really, it's just like, just bring your voice, right? It's voices. So bring your genuine voice. If you have a genuine question, genuine concern, bring it up. Let's talk. Let's talk. That's why we do this. Okay. Now, again, back to the topic. Is the vaccine the answer to the pandemic? Loss, hope, and uncertainty. Now, I want to get into the artwork. So the piece that I made, it's about, I'm just winging it, like straight up winging it. It's like 30-some inches by 20-some inches. It's charcoal, graphite, acrylic, and confetti, like literal confetti on paper. So what I wanted to convey with this piece was like that, and this is why I use a plague doctor, and there's like cells, like cells from the virus, and there's bats, and like these papers right here say like 2020. It says 6 feet, masks, social distance, unemployment, the rates are skyrocketing, right? They're going up and down, up and down. It says right here, there's an eviction notice. The cells are everywhere, contaminating everything. There's skulls. There's the skulls over here turn into like this rising bar, like up and down. So I wanted to build this anxiety, right? This like what is going on, like this darkness, this anxiety, this depression, which kind of explores the mental health aspect of the pandemic, of what all of this is, you know, and what it means to us as social beings, as social creatures, and how that leads into our choices moving forward. And then in the center, you see it cracking open. So, and when it's cracking open, you see the colors, you see flowers, and they're more like representative of hope. You know, you see the confetti. Now the confetti, like for those who don't know, the confetti I added in there, and you could, if you were to like look closer, there's actual literal confetti, and that goes back to the cascarones, right? So my family, us, all of us, we save these. For those who don't know, we save eggshells. We wash them out. We save them all year, and then we fill them with confetti. And then on Easter, we crack them on each other's heads. And then the confetti comes out everywhere, and it's fun, it's festive, right? So it's like when you smash the cascarón on somebody's head, it's like a violent act, right? It's like a violent thing, but really, it's more like once you get through that destruction, through that violent act, it's festive, it's fun, it's hopeful. So that's like kind of trying to find redemptive qualities in through the tragedy, is what the metaphor is, right? So yeah, that's what the piece was about. And speaking of trying to navigate, speaking of trying to like figure out what's hopeful, what isn't, and all that through negative stuff, through tragedy, that brings me into my next thing, into the actual, like, into my actual concerns about it, because I haven't taken the vaccine yet, right? And a lot of my family and friends in Texas already have them. They're already rolling them out. Minnesota hasn't had them yet, really, for the general public. So I'm still wondering, like, okay, what is it? You know, what I like, I don't know. And then I'm watching people post online, and I'm like, okay, cool, it's not too bad. But then I'm like, well, you know, I put like worse things in my system. I'm like, but then I'm like, oh, but I don't know. So I was like, I was like on the edge about it, like still having these questions, not knowing what's going on. And then talking to my mom, she's in Texas, y'all know. Shout out to my mom. Mom, I love you. So she has COPD. She just got diagnosed actually a couple of days ago with pneumonia, walking pneumonia. So I'm worried about her. She hasn't taken a vaccine yet. She's still on the fence about it. I see friends and family on Facebook asking like whether or not they should take it. Other people taking it. I know Texas already lifted the mask mandate. So yeah, there's a lot of questions around that. There's a lot of questions. There's a lot of questions I have, my loved ones have. Some people have taken it already. Some people are wondering what they took, and some people aren't sure. So that's why I feel like it was important to do this conversation, like start this conversation. And that's why I reached out to Miguel. Shout out to Miguel, by the way. I missed him this last time. Shout out to Miguel Valdez for coming through, helping with everything, and yeah, helping me put this together, helping us all put this together. So yeah, we felt that it was time to drop this topic and explore this. So let me get right into it. I'm gonna get right into the speakers, and we have two amazing speakers today. Thank you so much. Now, Dr. Suarez, Dr. Laura Suarez. Dr. Laura Suarez is an assistant professor of psychiatry and currently part of the clinician investigator training program at Mayo Clinic, where she is conducting a qualitative research study to characterize psychological distress in patients with heart failure. She earned her medical degree at Pontificia Universidad Javeriana in Bogota, Colombia, where she is a licensed general practitioner. She completed a research fellowship at Massachusetts General Hospital Cardiac Psychiatry Research Program, and subsequently completed psychiatry residency and a consultation liaison fellowship at Mayo Clinic. Her clinical interests include the overlap between medical illnesses and psychiatric conditions, in particular cardiovascular and transplant psychiatry. And her line of research has centered on behavioral cardiology. Dr. Suarez has also worked closely with Spanish-speaking populations and is very interested in trainee and faculty education on the topic of cultural humility and competence in psychiatric practice. Okay, now, Dr. Medina-Inojosa, I am waiting for real quick for my laptop to unfreeze. 1 second. I'll just pop it up right here. Okay. Boom, 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 boom. All right, here we go. Computer's too slow. All right, Dr. Medina. Dr. Medina-Inojosa is an assistant professor of medicine. He is from Venezuela, where he underwent medical training at the University of Carabobo. He came to he came to Mayo in 2014, where he completed a postdoctoral fellowship and master's degree in clinical translation science with a focus on population health. He currently serves as a physician scientist at the Division of Preventative Cardiology, Center for Regenerative Medicine at the Department of Cardiovascular Medicine. His research expertise includes big data analysis, clinical linkage of disease outcomes, cardiovascular risk prediction, and assessment at the population level via traditional and novel data science methods. Jose has a strong interest in understanding and reducing Latino health disparities. His views do not represent that of his employer. So now that we got those down, thank you so much once again to both doctors for tuning in. And I guess I just want to dive right into it. And feel free to answer anybody who's comfortable. I guess this is more for Dr. Suarez. What do you feel the overall impact has been? What are some signs of the overall impact so far regarding the pandemic? Like, how do you think it's affected us, and in what ways? And is there a solution, or is there a way to alleviate certain things that we're going through?
Yeah. Hello, everybody, and thanks so much for having me here. It's exciting. So yeah, I think the pandemic has had a lot of mental health consequences, and in a way it's normal, right? When we go through difficult circumstances, stress happens, and that's a normal reaction to difficulties. We all encounter stress, we all have to have some anxiety, and to a certain degree it's normal. And the big part that causes that is uncertainty. And this has been a huge time of uncertainty, right? So a lot of the information comes every day. Now is the vaccine, and that lack of understanding really makes us feel stressed. And when the stress becomes like a more difficult to manage, what our brain does is that it makes us sort of imagine kind of the worst outcome. So we catastrophize. So we start like making this like sort of snowball effect of all the bad things that could happen. And that builds into the stress. And that's when things become problematic. And that's when depression and anxiety disorders can happen and become like a difficult part of our life, preventing us from completing our daily tasks. And as an additional thing that happens with kind of the stress and the anxiety that comes with that uncertainty is physical symptoms, right? We start having maybe muscle aches, headaches, difficulty with sleep, and all of that kind of comes sort of in a package. But the good news is that there's absolutely ways to manage that. So there's ways that we can learn to kind of balance out the negatives. And there's specific things that we can do in a pandemic to do that. And I don't know, for those of you who have heard maybe the word resilience, but resilience just simply means adapting to difficult times. And we can be adaptable, our brains and we as humans adapt very well. And there's ways we can do that. So of course, maintaining our health. So good sleep habits, eating healthy. For those working at home, maybe having a schedule, having routines that sort of makes us that kind of work-life balance in a way. That's very helpful if there are children around, of course. So that's huge. And if we think about the vaccine, well, that sort of has a little bit to do, and we'll talk a little bit more on that about how to maintain our health as well as the health of others. The other thing that's important is stay connected. So this pandemic has really impacted our social connections in many ways, right? We are social beings. We like to interact with others, and that makes us happy. So being able to continue to socialize and enjoy the different ways of connecting with others. However, it's important to disconnect, right? So it's sort of connecting while disconnecting, and having limits, because being online all the time and being connected also allows us to read and get a lot of information that sometimes is not the right information we need. And that's kind of the point of the next point is limit what you get and what you read about the pandemic. And sometimes a good recommendation would be maybe 15-20 minutes, couple times a day, where you read specific things about the pandemic. Always look at good trustworthy resources, and just kind of set limits on that, because the social media and our friends and our chats become huge on the pandemic, and then we don't know who to believe. It becomes another source of uncertainty, and then building up on that stress. So socializing, connecting while making limits in certain things, and then disconnecting at times. Staying active, physically active at home, outside of home, exercising, and if able to practice some relaxation, something called mindfulness, which is kind of sort of staying in the moment and enjoying kind of the moment, no matter where you are or what you have, without kind of judging that moment. So there's definitely a lot of things you can do to sort of balance out the negatives of all that pandemic has brought. And we know that doing that actually prevents people to get into really bad depression or really bad anxiety that might require you to maybe see a psychiatrist or even come into the hospital.
Yeah, that makes a lot of sense. And especially like, because I know like us coming, like me, I come from a very big family, both sides, my mom and my dad's side. And we're so used to being together always, like everything, family, like gathering, even just on a regular day. And I know that like being in a position where we had to like separate for the safety of our loved ones put us in a position to where it was like, you know, people like people who wouldn't usually feel depressed started to feel that depression set in, started to feel that like that longing for our family, for our friends, for our loved ones. And it's crazy because even people who would consider themselves introverts also were like, I just want to get out the house. I just want to see other people. Like, I love being by myself. Like, I love spending time alone. I love all that. And I just spend a lot of time alone anyway, making work. But then it's like, you know what? Oh, this is different. This is like, it's not to where you. It was more of like, it's different when you have a choice, you know. And it's like, yeah, I choose to be on, but you know, everybody's out there. But then it's like when you know everyone is just like gone. It's like this kind of like universal solitude, and it's something different that I had never dealt with before. So like that, okay, like that, like anxieties and depressions, and like, okay, tuning in. I personally have gone, like, I signed up to the gym. I go a couple of times a day, and like even like just like something like Planet Fitness, it's like $10 a month, you know, and you just like boom, just run it off. Even like today before the talk, just run it off, just vent a little bit, because now you feel it to where like you want to do something out and about. But what do you think when it comes to like, what are other ways, like say somebody who's having a difficult time with getting up, getting out, getting active, doing these other things, what are ways, and I think we had covered mindfulness before, but is there any other thing that you would suggest for someone who's feeling depressed or feeling anxiety? And then, you know, and now we have the vaccine on the horizon, and it's already there. So people who haven't taken it yet, it's like, okay, this is that. What do you feel are ways that they could kind of alleviate some of that?
So yeah, so that's really important. So for depression, one thing that's something important is depression sometimes want people to do things like staying in bed, doing nothing, even maybe coping by using more alcohol or even drugs to sort of kind of numb the feelings. So one of the things you have to do with depression is really try to do the opposite. And sometimes we have to ask someone to help us with that. But one of the things that is really helpful is something we call behavioral activation, or sort of writing a schedule or having a schedule for ourselves where we say, well, I'm going to get up out of bed and take a shower, sort of like a to-do list. I'm going to make breakfast, something enjoyable. Maybe you don't have much of an appetite, because that can happen with depression. Or maybe your appetite is just wanting you to eat really, really bad kind of food. So trying to be kind of moderate that, but you can like do something, and then build some schedule that's easy, right? I always say baby steps, right? One day at a time, but try to make it something that you can accomplish, and almost like a task. And the more you kind of get into the routine, the more you get out of bed, the more you do some activities, the better depression gets. Of course, when depression gets to the point where that is not even possible, sometimes people feel the body's heavy, where they cannot move, when they have negative thoughts or even thoughts that they want to kill themselves. That's a time where you definitely need to call and ask for help. There's multiple ways to ask for help, either calling the suicide line, calling 911, calling a friend, right? We want you talk about it and get the help you need. So there's that. There's kind of doing the opposite, and then sort of measuring where you are, and being able to share where you are with someone you trust, so you can get the help you need. For some people, that might require just some medication that you take and that start giving you energy and sort of that path to recovery. Others might need something else. But I would say behavioral activation is one. And then add to the other things that I just said. Just you have to do it slowly. And sometimes you have to write it down and make it a task, because your brain really doesn't want you to do any of that. And then anxiety is interesting, because what anxiety wants us to do is to avoid. So we're afraid, we're scared, so just not do anything. And what happens is that makes anxiety way worse. So slowly, and kind of gentle, very gentle, you have to really do things even though they're scary for you. So I'll say the vaccine, for example. Let's say you're on the fence, but you think might be a good thing for you. Of course, you can talk to your doctor, answer the questions you have, but maybe just not doing it is going to create more anxiety, because you're just going to keep thinking about it. And the more you think, the more anxiety you build up. So sometimes that happens, and that's why kind of exposing to things helps. And exposing might not be getting the shot right away, but talking about it, going to your doctor, getting good information, reading, and making sure that you're making a good informed decision. So that's in terms of anxiety. There are other things that happens with anxiety and the pandemic. Seeing our grandparents is very scary because we're worried about them getting sick. So just being able to first do things that you can control, because we often get scared about things that we can't control. And there's a lot of things in the pandemic we cannot control. So don't think about those that much, because there's no point that's going to increase your anxiety. And rather think about those things you can control and just slowly do things. And that helps alleviate anxiety. Of course, if the anxiety gets to the point where you're having panic attacks or it's super overwhelming, that also might require help from kind of specialist. But it's something you can do with mindfulness, with relaxation, and with just slowly doing things. Exercise is phenomenal. Exercise is a great antidepressant. It's a great anti-anxiety.
Oh yes, I completely agree.
Mm-hmm.
And that about baby steps, it's like I literally get to a point to where if I have like a very down, and I've learned to like ride the ebbs and flows of life. So when I'm down, when I'm in a creative zone or whatever, I'm making stuff. I'm hype. I'm energetic. But then when I crash. But then I get to a point to where it's like yeah, I'm done. Like, so what I'll do is I'll literally move the easel by my bed, and I'll just like draw right by my bed, or I'll just write a to-do list, like literally while I'm there, like laying down, and I'll start there. And I'm like, okay, if I'm really, really down, I'll have a to-do. I have to-do lists like all day, like my whole house is filled with to-do lists. And I'll start with just like whatever I can do. I'll write while everything is just, okay, I feel like laying down, then I'm going to do it laying down. I'm going to start right there. I need coffee. I know that'll wake me up. Okay, I'll do it laying down. And I just lay down and I'll write the list, drinking coffee. But yeah, by the first cup of coffee, I'm up. Okay, boom. And I'll just do like that, those baby steps, because especially with checklists, with to-do lists, you want to have this thing in your head to where like you're, the thing about checking off a to-do list, that's like a shot of dopamine, you know? It's like, oh, check, done. So the more you check things off that list, the more like, oh, okay, I can accomplish these things. Okay, so then that you know, that builds that new belief in yourself. But so now we get into something as big as something, applying that to something as big as a vaccine, right? For me, the baby steps into the vaccine and into knowing more about the vaccine are, for instance, seeing my family and friends who've already taken it, because they will post online, or I'll talk with them. Hey, how do you feel? Hey, what was it? Hey, the side effects. Are you still alive? Like, and like, you know, so that's what it is. Like, oh, okay. And then also like, man, like I said earlier, I put the craziest things in my system before when I was like, whatever. So it's like, okay, those are my baby steps, you know what I mean? And then still, it's like, before you take that leap, then you have those questions. So, speaking of those questions, Dr. Medina-Inojosa, I would like to go to you with one of the first things right off top. So, one of the main questions that I had was, so, you know, my people, my family and friends in Texas have already started taking stuff, started rolling out. In Minnesota, we haven't started to roll out for general public. A couple of my questions were that were like kicked off by that were like, how do you think they got it first? And is there a difference in the vaccines? Because I've been hearing a lot, and I'm sure you have, about the Johnson & Johnson, the one and done, Pfizer, Moderna, and everything. So, like, how do I know what is the vaccine? What are the differences in the vaccines? And like, how do I know that it's safe?
Well, that's a very good question, and it has several steps. I think I would like to start by saying that mitigating one of the questions that most people have, and the question is, did we rush this vaccine? Was this done, and are they experimenting on this? And the clear answer to that is not. There's two major factors of several factors that help this vaccine get out and rolling. The first one was that it piggybacks on existing technology. Based on current work that was done, coronavirus is not new. I mean, the class of viruses is not new, and work on the delivery on the type of vaccine that we're receiving is not something that was started the first day or that we had a case of COVID. So that's the first most important one. The other one is the amount of support because of the severe consequences, economic, mental, and health consequences, more importantly. All the resources and energy was completely driven, and from the scientific and healthcare community was completely put into the vaccine, meaning that it shortened a period that for other less harmful, let's not say less harmful, but less acute diseases will take decades or years. Everybody was all hands on deck. Here's all the money, here's all the resources, here's expedite reviews, expedite clearing, let's analyze the data quick. And that's why it was gotten to us in a faster way, because we needed it. And we need vaccines for and medication for other things, but here everybody needed it at the same time. A lot of resources came in, and that's how it happened. Now, does that mean that because of all the resources and the shortened timeline and the expedite and let's get into warp speed and let's do it faster, does that mean that the experiments needed were done expedited as well? Well, more people were volunteering for the trials, right? Experiments were being done in extra hours and working for extra hours, but we did not sample. The scientific community did not do smaller experiments or faster than normal experiments to get this answer, which is something hard to understand because it took less than a year to get the vaccine, but it's one of the first times that you can see that over 44,000 people were enrolled for a vaccine study in less than 4-month period. So everybody worked on this vaccine, and that's why we got it so back, and we had existing technology that we worked around it. So that's extremely important to understand, because one of the most common questions that people have is, are the experiment, like if I go get my shot tomorrow, are they experimenting on me? And the answer is no. Now, with that being said, they are going to, there's something that's done regularly for medicines and for vaccine is post-market surveillance, which means I give you one shot today, I give you a second shot depending on the type of vaccine, or only one if it's a Johnson & Johnson. I am supposed to watch to see what's going on, because there's adverse effects that are not expected, that because of the technology, because of the type of delivery methods, we're not expecting this adverse effects, but we do surveillance to make sure that everything for two reasons. One, make sure that everything's going well, and two, to mitigate the uncertainty, right? Because if you say, well, a person got the vaccine and then died 2 hours later, then you don't really know without surveillance, was it the vaccine or was that person already having a disease that was causing that. I remember that I did one similar talk to this with one of the people that was involved in developing the vaccine, and the person gave a very clear explanation. 44,000 people were enrolled in the studies, and humans die. Humans tend to die just because of time and faith, and that was supposed to happen, right? It was not related to it was found that it was not related because of the vaccines during the trial. There was found that there was no major adverse effects. Some of the things that happen are given by faith and just by the common timeline that the people have, and that's something that we just have to look at. And the way that we answer that is with numbers. More people died in the placebo group, which is basically the non-vaccine that was given in the trial, than in the actual vaccine group. And that actually helps you understand, okay, the vaccine doesn't hurt me, the vaccine is not going to cause adverse side effects, et cetera, right? That's a more important thing. Now, let's talk about the 3 types of vaccines that are available there, and why. One thing to know is both Dr. Suarez and me probably have had both of our vaccines. We have been vaccinated with either the Pfizer or the Moderna vaccine, just because we're healthcare workers and they were brought to us first. And I always give this anecdote that I was working out when I got the email that said it was time for me to get my vaccine. I was in a bike and I almost fell off the bike trying to rush to the computer to schedule the vaccine as soon as I could. And that's probably, and if you can see that in the community, in Twitter, in Facebook, and in all social media, you will see that shot of the doctors, the photo of the doctors and the healthcare workers showing you how they're getting the vaccine. And that's the best testimony of the people that are in the front line, seeing people getting sick, are rushing to this. The people that are scientists and they understand how these things work in very fine details, they were running, falling off the bikes, trying to schedule it and then move it to give it sooner to me, right? If I can find an end of day appointment, I'll cancel with my dinner plans and I'll go get it right now, because they know how relevant this is for us to get there. One important campaign is the campaign of this is our shot. So it is true, the vaccine is our shot to mitigate the effects of the pandemic. And we can see it right away. Now that a good amount of people are vaccinated, then you're seeing the restrictions going down. Now, if your people can join in the same room without mask, if they're had both a complete vaccination and the period that it takes for the immunity to kick in. So that's hopeful. It means that if we go and get our vaccines when it's our turn or when it's available, we're gonna be able to go back to normal, right? And normal, we don't know what normal is gonna be, but likely in a place where we're gonna be able to hug our grandparents, like Dr. Suarez was saying, or hug our neighbor, or be in the same room, or not in a Zoom conversation like we're having right now, even though everybody got very good at it. I mean, we might learn something from it. Now, I did a big introduction to talk about the 3 types of vaccines and the efficacy against them, across them. Now, everybody knows that the Pfizer and Moderna vaccine have very similar efficacies, but we have to understand the endpoint that's measured when that is conducted. So the trial for the 3 vaccines is a randomized trial. It means no one knows right off the bat who is getting what. Some people are getting the vaccine, some people are getting placebo, which is an equivalent syringe with equivalent liquid that looks exactly the same way, and it's impossible to know if it's a real vaccine or not. It's actually, you're going to only probably the statisticians eventually know, not even then, because they're probably gonna, there's very much a lot of care is done to people not knowing what's going on, so we can know that this is true, right? So the trials were looking, the outcome of that, or what they're measuring, was actually symptomatic COVID infection. So randomized control trial, some people get the vaccine, some people don't get a placebo, and they measure the symptoms. So it means it's reducing the proportion of you getting sick enough for you to actually get symptoms and go get tested and become positive or negative, and that's how they looked at it. The difference between that and the difference of what the vaccine is helping us, which was a secondary endpoint, which is the severe COVID infection that require hospitalization, ICU for months, and death. It's not that 95 number we're comparing. That number is close to 100% in the 3 vaccines. So yes, and now let's go to the other vaccine, the Johnson & Johnson, which might have, in that endpoint that I just explained, as lower efficacy. One, yes, it's one shot, so that by itself gives you less of an immune boost, but they're equivalent to the other vaccines. But it was conducted in different countries, not just the US, and in countries where some of the more resistant types of COVID were present. So the symptoms, and it's those genotypes that express faster and are more symptomatic, right? So that's why the efficacy for that endpoint is to be a little lower. But for the severe infection, for the death, they said they tend to be almost perfect. So that, comparing the 3, and in a nutshell, get the vaccine that is available to you the fastest. If when you try to schedule it, it's a Pfizer or Moderna, get that. If it's a Johnson & Johnson, get that. Don't delay it a couple of weeks. Don't delay it an hour. To get whatever as soon as possible. Because, and Dr. Suarez is laughing because we have to take that exaggerated Latin gene that I have in me and say, go get it, right? Find it. Because that's the other point I was going to also make for you, Bobby, is for the vaccines, it's not easy right now. It's in some counties, and you have to refresh the website a lot and make phone calls, and some people get frustrated because it's like, oh, I'm calling the number, they don't pick up, but it's because it's an online system that works better. So there's a lot of things that we're trying to figure out right now. The good thing is that even in Rochester, it's getting to Walmart, it's getting to CVS, it's getting to the places that we're used to getting the shots and that we're used to just knocking on the door and asking for it and helping us schedule. So it's going to be more accessible more and more. So the groups will improve, and as you say, and as you saw across the last couple of months, we went from the healthcare workers that were in the ICU to everybody that worked in hospitals to the elderly people that are in the community to now younger people that have some comorbidities, and we're gonna get, by the weeks we're gonna, and depending on the places, but by the weeks we're gonna get more access to it. And the most important thing is go get it, right? As soon as it's available to you, keep looking at how Dr. Suarez was saying, like social media and wherever you get your good information for updates on that. This show might be a good way. The Minnesota Department of Health, for those in Minnesota, is going to be a good way to get your information. Make sure you get it from trustworthy sources. To summarize, this long intervention is safe to get the vaccine. I can keep talking why it is safe. You saw all the healthcare workers getting it as soon as possible. You should try to do the same. It takes some effort for you to get scheduled, but go and get it as soon as possible, okay?
Thank you. So going back on what you were talking about, as far as information and trustworthy information, the first thing that I do when anybody sends me any kind of anything to do with like any doubts or whatever that they have is they send me links, and the first thing I do is check the website. And there's a way to check the websites, check the credibility, check the there's a rating, and also consider the source, like who it is that's saying these things. What are their what do they think about other things in general? Those are just a few of the things that I think about. So somebody brought something up to me too that I feel like also was a little bit like it had like there were a couple of people that already had these questions. So like DNA. So does the COVID vaccine does it I think it was like, does it mess with your DNA? Also, do you get COVID from it? And also what is the worst that could happen with the vaccine? Could you die from it?
So I think both Dr. Suarez and I can take a stab at this question from different angles, and again, there's several types of vaccines across the world. There are different mechanisms. We and most of the people watching here are going to have either Pfizer, Moderna, or Johnson & Johnson. But with that being said, none of the vaccines are going to mess with the DNA, with your DNA. It has some of the, and most of the vaccines that we're going to get access to have RNA, which is something different, and it's RNA of the actual virus, not of any type of transcriptor protein that would actually mess with your own. It's just the exposure to it. So it's like you're getting the call from the virus, but it's a mute. So you're like, oh, what? But now you have the exposure to it. And we can have several analogies of this, but basically it's like you were exposed to it, but not in a way that it's actually getting the virus in you. It's in a way that the body gets the call. It gets like it's affected to it, like it knows it's there. It starts responding to it, knows how to respond to it, but it was actually never there. So it's kind of cheating our own body to respond to the body, to the virus in several ways. Now there's vaccines, and it might not be important for our audience, but there's vaccine out there that have the mechanism where it has the dead virus in it, and it's not vaccines that are applied in the US, but those vaccines have been tested and they're safe as well. They haven't tested in the US, but none of them are actually going to either mess with your DNA or actually give you the virus in a way that you could get it. Stepping a little bit more on the virus, attenuated virus, which is not something that we're actually going to be getting in the US, like I said. A lot of the vaccines that we get as kids, as an adults, are those type of vaccines, and it's very infrequent that people actually get the actual disease from it. It's just a immune response that what we're trying to achieve. So yeah.
And I'll add one more thing. Like when we think about the RNA, which I think a lot of people have questions about it. It's like the messenger. I think you were saying, like it kind of gets the call and it brings the message to the cell so they can really produce and get our immune system to work, but it really gets broken down pretty quickly and out of our system. So it's not something that actually stays in the system. And I think that's important to remember. It's just sort of like a way for our body to know what they have to start working on, and then it kind of goes away, but our body responds and creates that immune response to protect us from COVID. It is not going to mess up with the DNA, and it's not going to give us COVID either. So we're not going to get sick of coronavirus after getting the shots.
Yeah. And that also goes to the timeline thing that I was mentioning earlier. There are reports of people saying, oh, I got my shot 3 days ago and I got COVID today. Well, you were actually exposed before it. Or, the first shot gives you some level of immunity. So that's why we ask people to wear masks and stay away and social distance as even after you get the first shots, because it's helping you prevent it, but there's a chance between the two. So to understand, and the other thing to also look about the timing is that right now we know that it's going to give us some level of immunity, but studies are being conducted on how frequently we might need to get additional doses. It might become like the flu vaccine, where we get one of these shots or a modified version of it every year to mitigate it forever. And that's how we handle pandemics and important diseases with vaccines. That scheme is something that we need to wait for the experts to tell you, and we're figuring out, and trials are getting done, and it's likely to evolve as we speak.
Those are really good points. So then on that, when we're talking about recurring vaccinations and things like that, where are we at regarding the vaccinations that are out now and the variations of the virus that are like revealing themselves? So can the vaccines that are already out, are they applicable to the variations, or is that an entirely different vaccine that has to happen, or how do you see that happening? So real quick before that, I just want to acknowledge the fact that you were talking about the way that this vaccine works. So pretty much what you're saying is like, it's just like waking everything up. Your immune system's like, hey, this is what you gotta look out for. Like boom, it bumps them, like wakes them up, like, hey, and it shows itself like, okay, this is the virus. Like boom, 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 wake it up, like, hey, this is where I'm at. And then it just, okay, that's what we have to fight against, boom, boom, boom. But not just like completely infiltrate your system or anything like that. Just if I have that clear. Now,
now let me comment on that. So that's why the healthcare field is very open about the non-severe adverse effects that we get, because with most vaccines and most shots, you're going to get pain in the area you're infected. You might get a little swelling. Your shoulder might hurt, but that's known. I mean, that's what we get, right? But with this specific vaccine, in a lot of cases, people get not flu-like symptoms, but they feel bad, right? They might even get a fever. They might even get body aches. I had my 2 shots. For the first shot, I got tired, and maybe I was just tired, and they told me I was going to get tired, and I went to bed early that day, and I was fine next morning, and went on a run, and it was great. For the second shot, they also told me you're gonna feel for a couple of days, and I did, but I was fine. I worked through it, and I've had colleagues that stayed home for a day or maybe 2, but nothing major, nothing that affected them severely, and that's very important for us to highlight.
And that really actually means that your body is responding well, right? Our immune system, when we get a little bit of that kind of mild illness after a vaccine, and I see it, I have a baby, and when she gets her shots, she feels icky. And part of that is that immune system is really working. And in a way, it's positive, although it's uncomfortable to feel that way. But it's important for people to don't feel scared, but rather think that the shot is probably working.
Yeah, that's a really good point. Yeah,
I want to give you some numbers for you to consider, right? We have had over 500,000 deaths and millions of infections with COVID in this country. Those are huge numbers and aren't seen from the flu or any disease. They're very big numbers for what that's why we're in the pandemic. That's why we're all fighting against it. Now, adverse effects that were actually attributable to the vaccines in the post-market surveillance are uncountable at the moment. There are very few, and I think close to none, that have been reported because of the safety profile that we've seen. And a lot of people might say, no, well, that's because they're trying to hide it and they're trying to, they're raising the numbers so we don't know. That's not what the officials are trying to do, because they're very open about it. And if it was happening by the millions, we would already know, right? There's millions of doses administered, no major adverse effects of what we're talking about. One thing that is very important and that people ask a question about is actually allergic reactions, right? Anaphylaxis. And I got numbers this morning before our call, and the rates that we're comparing are 0.02 or 11 per million. So 1 million shots have to be given for 11 people to get anaphylaxis, which is something that, as Dr. Suarez knows, can be mitigated right there with either a pill or a shot or observing people, or a few of the people have to go to the hospital for a bit. But we're talking about this very rare consequence of the vaccination compared to the more than 500,000 deaths. So the proportion is clear that what we need to do is get the vaccine. We're getting better at understanding who gets allergic reaction. Most places are having people with history of allergies and people that choose to stay and being observed. You sit there, it happens within 15 minutes. So you just sit there and, have some coffee or water, or just, scroll through Facebook for 15 minutes and they observe you, or 30. And then you go and come back in 15 to 20 days and get your next shot, and life gets normal and we go back to being normal, which is what everybody wants, right? The new normal, we're not going to know. I always say the new normal because we don't know how different it's going to look for now. But right now we have evidence that people are allowed to be without masks in the room that they were not, right? So it's getting better. So something to look for.
Oh yeah, definitely something to look for. And I think that's why these discussions are like really important for that. So going back to my question is, what are we going to do about the variations? Do you think that it's going to be a new vaccine? Do you think it's going to be, can we just stay with this? And then is it going to be, or is it going to go back to like what you said, like where it's a yearly thing that kind of is all encompassing?
Like the flu.
Yeah, like the flu.
So right now, it's all about data, right? And we're looking at the data, and we're following basically the CDC's and Dr. Fauci's recommendations. And the recommendation is do not hesitate to vaccinate because of the variants. There are variants that spread faster, which is the problem. And the vaccines might or might not be less effective against those, but if the person's already fully vaccinated, it's harder for the virus to go from one person to another. So it makes a lot of sense. Right now, those things are being studied as we speak, right? There's different trials, there are different exposures. We're actually starting to genotype the virus more, because that's another important point that I heard from a virologist a couple weeks ago in a podcast, is the variants have always been there. It's just that we started actually genotyping the virus, and now we understand we're actually finding them because we're looking for them, because we found differences in the in the infection rates in some places, and that's why we started looking. What we know is vaccines, social distancing, and masks are working because the cases are dropping. That's why the restrictions, which is what most of the people are worried about, and the fatality, but the restrictions are being eased out as we see the data working. So it's another reason to go get the shot as soon as possible, as soon as it's available.
Yeah, because the way that you put it is like, if you don't like, with at least with one iteration of the vaccine, it's like putting some people on the front line, right? And it's like putting some soldiers on the front line. And if you don't have any, and then the variations come, the variation of the vaccine or whatever, then you have no soldiers on the front line. But if you have at least one, at least you have the vaccine that's there now, at least you have some soldiers on the front line to
exactly.
to hope, hopefully fight a bit.
And I had a coworker come to me and ask, with some doubts about getting the vaccination because she wanted to have kids 6 months from now. And she's like, I don't know, and no one knows, and the data's not ready. By that time, I was asking her, what would you do? And I said, well, you're not asking, you don't want to have kids right now, so we know that you have some time to wait, even though the data and the mechanism and everything suggests that it will not affect your fertility, that it will not affect your potential to have kids, and your potential for those kids to be healthy. But I told her the main reason in your case I will get the vaccine is because by doing so, you work in a hospital. So you become in the shuttle that goes from a place where people are sick and going to a place where people are not. So you might be bringing it to them. But now if you are vaccinated, you're not the shuttle anymore. And you're also serving as an example. So when your family members get access to it, you're also going to go get it. They're also going to get it because they follow your sample. They saw that you got a little bruise or you got a little pain. You got maybe took some soup and you were happy after. And that's the way for us to get better.
Yeah, I actually love that. The idea of just thinking about getting it for others. Some of us younger and healthy, we are like, well, but one of the good things is just getting it to prevent our elderly, our grandparents, our parents, even our children get sick. And that's, I think, in such a pandemic where we've lost so much, I think it's a little bit that we can give to our community is to do that and try to kind of bring that hope and help us kind of move forward with that. So I really like that.
So as a selfless act as well, as one to look out for yourself, and so one of the things is one of the questions that popped up too, and we're going to get into Q&A right now. Can you, and you know what, we might as well hop into the Q&A. So yeah, I feel like I've already hogged up the Q&A section and we've already covered a lot. So we're going to open it up right now, and I'm going to start off with a question that just popped up on Facebook. If you have any questions right now, I'm looking right at the camera. If you have any questions, ask them, post them, put them in the comment section, and let's get right into it. Let's get right into the Q&A section. And yeah, so I'll kick it off with a question asking, if I already had both doses of the vaccine, can I still get it?
You can. You can still get COVID in a very, very finite proportion. What we know, right? It's 95% of, let's say 5% it might fail. That's why we're still recommending masking. That's why we're still recommending social distancing across people that are not vaccinated. And that's why we are still observing what's going on. What we do know, based on the trials and the vaccine, is that you might get it, but it's going to be much milder than you were going to get it before you had the vaccine. So that's the important part of it. The numbers are so small of the likelihood of you get it, which is not an encouragement to go outside and hang out with others. It's an encouragement to go and get the vaccine. That is negligible, right? It's not going to be major, the likelihood of that. But that's a number where I want to encourage you to vaccinate and keep following the rules for a while, not for you to go get a vaccine and then go live maskless around there. But yeah.
So then, so when you get the vaccine, if you get the vaccine, or when you get the vaccine, can you spread it? Is there a way to spread that? Do you spread the vaccine, or is it? Excuse me. Is it better for you to just hang out with people who already had the vaccine?
Well, that's what you're allowed to do right now. That's what the guideline changed a few days ago. If everybody's fully vaccinated, which is fully vaccinated, it's not one shot, and let's not bend the rules, we're close. So, if you're fully vaccinated, if you have a household, you have a neighbor that has both shots, and then there's, depending on the shot, I don't remember off the top of my head, but there's a few days that you have to wear before they consider it to be, and they'll tell you that when you get the shot, saying, it's 2 weeks or something like that, 10 days. I don't remember. But basically, when you're considered fully vaccinated, it's the moment where you can say, I'm going to probably hang out with my neighbor and have a beer, right? If there's someone there that is not fully vaccinated, well, maybe FaceTime them, try to, kick them out of the patio or something, but they shouldn't be around for right now. We're talking about weeks before this gets better, months before this gets better. So the recommendation is to hang out with a few of the people. So start being conscious of that.
Okay, so we're gonna go to the. Do you have any on the event right there?
It was just related to the variants, but he already explained that.
Okay, so if y'all have any questions, feel free to send them in. If not, I'm gonna go with okay. Underlying medical conditions. Okay, so let's go back to my mom. My mom has COPD. Say anybody has asthma. Say anybody has anything underlying medical conditions. Does the vaccine affect that in any way? Does it put you at risk in any way? Are there certain conditions that are more at risk, like to where you might want to stay away from the vaccine, or
So in reality, the only risk that you could have is not getting COVID based on the vaccine, because specifically for those diseases, let's say you just mentioned COPD and asthma, that is actually the people that are younger that we're trying to vaccinate right now. So it's actually an indication. People with cancer is an indication. People that have a combination of these, depending on the state where you are. If you have 2 or more diseases diagnosed by a physician, then you're getting it right now. There's states, I believe Texas and Florida are one of them, where you can get a signature from a doctor if you're younger. If you're older than 16, you can get a signature from a doctor in a form that says that you have a condition which is listed in the CDC. You don't have to disclose what the condition is, and they don't have to verify it, but they do have to have a signature to get ahead in the queue, right? So there's not a major number of diseases where we say, if you have any of these 4, stay away. No, it's actually the other way. If you have any of these 20, go get a vaccine sooner. If you're obese, if you have as kidney disease, if you have a lot of what we call the comorbid conditions, and you should look into your local Department of Health website for that. The CDC website is also pretty good. Has the list of those, and it's updated frequently on what's going on.
And I'll add for allergies, which was said before, but it kind of ties a little bit with illnesses. I actually have a severe allergy to shellfish with an anaphylactic risk. And actually I got vaccinated and it went pretty smoothly. So for most people with allergies, if not all, and actually medical conditions, we recommend vaccination.
And then I'm allergic to a pain pill, which was prescribed for me for a time that I got hit with something, and I took it and I got hives. And that was in my medical record. When I went to get the shot, they said, okay, you gotta sit down there for 30 minutes. It was a lounge chair. I just sat there, talked to the paramedic that he was watching me, and probably play on Facebook for a bit, and then it was fine. So we have a plan, and the plan it's in place, and we have ways to treat you. So anaphylactic shot or allergies are something that people should be afraid of because they're severe. If you know that you're allergic like to peanuts or something like that, or nuts, you're careful and you know what they mean. If you're allergic to a medicine, you know that you got hives and you got scared. But in this case, what you're getting in your arm, there's someone ready to wait for you and take care of you and get you where you need the care you need. So we have a plan. It's very organized. So but we need some people to show up and start looking for the appointments. Like I was telling you, for the folks in Texas, it's rolling out pretty quickly. So look at your local Department of Health information. One other thing that I wanted to say is for those listeners of your show that might have questions about how immigration might be affecting your ability to get the vaccine, IDs, and how might be affecting that. you got to check with your local department. But in the case of Minnesota, if you're getting it from the Department of Health, you do not have to prove residency. You don't have to have extensive ID that shows your immigration status or insurance or anything like that. For CVS and right now, and that might change, for CVS and Walmart, they do need some additional documents, but it's something that you can easily look online. You shouldn't be afraid of it. It's not considered public charge to get the vaccine. It's a humanitarian component that it's how it's being dealt. There's no charge for it or any of the cost for the COVID illness. So it's important for people to know that they should seek care for any symptoms, any testing, and even a vaccine when available to them, because it's not going to affect their immigration status. They're not going to be affected in any way if there's their papers are in the works, et cetera, et cetera. It's important for people to know that, especially if they have to go to the doctor. You feel if you feel bad, go get it. If you're not feeling good, go get a test. If it's positive, follow the recommendations that are given to you at the moment, because it's not going to affect you negatively. We need to save your life. We need to get you the proper care you need. So you got to go to the doctor and follow the recommendations. Okay.
Nice. Thank you so much. So we just have the last question and a half. There's a hat. So should children take the vaccine? And so it is not okay. So should children take the vaccine? And what was the other one that we were talking about? What can we say to a friend that is not ready and wants to wait but is embarrassed? So what can we say to a friend who is not ready, kind of embarrassed, and should children take the vaccine? So those, I guess, because we don't have any other questions, we're gonna go with those, and we can always add. We're gonna add some resources and stuff. So yeah, should children take the vaccine, and what do we say to a friend who's embarrassed, who's unsure, who's not ready, who's still on the fence? Like, what do we say to them?
I would really like to hear Dr. Suarez answer to this, and I can probably take some notes on how to convince people. So I'll mute myself for this one.
So I think the first thing is let people get educated and read. And sometimes we are at different stages of learning, right? So I may read a little bit about something or hear this podcast and be ready and say, boy, this is great. I'm ready to get the vaccine. But that might not be the case for everybody. Some people need a little extra reading, sort of in Spanish, we would say to like tuck it with the pillow at night and maybe go to the doctor.
In Spanish, sorry. How do you say it?
Hablar con la almohada, you know, like at night you reflect with yourself and give yourself the time, right? I think there is a lot of pressures in the pandemic. And I know there's some social pressure too, because if you're the only one who's not vaccinated, people are gonna look at you, right? There's some judgment there. But take your time to be convinced, because also you want to be comfortable with the decision you're making, right? But the decision you're making, it has to be an informed decision. And what that means is that you have read information from trustworthy sites or from doctors or scientists who know, and you've maybe talked to people who've taken the vaccine and who can tell you their experience. Because a lot of the times we create our own even stories from information that's not true. And that fits into our stress and into our ideas of why we're not going to get the vaccine. So get informed, trustworthy information, take your time, right? There's no rush, but at the same time, if you have some illnesses, I think being quick, if there's your turn, I think that's important. But be comfortable with the decision you're making. And just connect with your support network, your friends, the people who've had the vaccine or who know about it, because that's really helpful. So that's one thing. And the other thing is, one of the things is there's no shame. I think the pandemic for all of us, it's been a lot of kind of news every day, like from treatment, from testing, from vaccines. Things come out and we all learn and we all go. So I would say that there's no need to be ashamed. I just think is you want to be curious about it more than ashamed, and just want to learn about it, get informed, and do what you think is best to you and your community. Because sometimes it might not be good for you, or you might not be convinced, but you live with your grandma, and then it might be for your grandma. So all of those things I think are important for you to do. That's kind of what I have.
No, that's a really
And the children, I like Dr. Medina go to the children, but 16 and over so far is where it's been really tested. So that's what we have.
Yeah, and
so
that's
far.
the answer. The answer is it's being studied in kids right now. We are going to focus on adults because of the known consequences in them, and we will follow the recommendations once they come. But there's every possible question that we don't have the answer right now for is probably being studied in a trial that assesses the process that we did last year with safety, efficacy, and post-market surveillance. So that's where we're focused on right now. 16 is it's important for you to know that the kids after 16, depending on the state you are, should get vaccinated. If you know that your 16-year-old kid or has some disease, you got to consult with your doctor, and you should consult with your doctor or your healthcare provider for your pediatrician or your family medicine doctor about the vaccines in general when it's your turn or any doubts that you have. As we said at the beginning, let's look for a trustworthy source. And again, Bobby, you're gonna put some resources with this episode. We like the CDC website because it's the most up-to-date version of it. For those Spanish speakers, clinicamayo.com or clinicamayo.com, mayoclinic.org are two important sources where there's curated information. We're unfortunately in a rush, and not in a rush, but in a race against misinformation. It's faster to share a screenshot of WhatsApp. And as Bobby was saying at the beginning, when I get a screenshot, I say, send me the link. No, but here's what I said, send me the link. Send me the link so I can read the whole article. Let's go. Okay, you have that screenshot. Let's Google the same thing to see what we find, because if something's true, it's gonna have a lot of resources repeating the same thing. So, and then look for it and validate it and connect with people that know channels that are in community where you can get access to truth and healthcare information. So, all good stuff.
Thank you.
One thing I'll recommend, last thing I'll recommend is there's an app. It kind of mixes the good information about COVID with mental health. It's by the Veterans Association, the VA. They do phenomenal mental health apps. This one is called COVID Coach. So pretty easy. It's free. And it has a ton of resources for your mental health, but also for COVID. If you want to get good information, that's a good resource that you can have in your phone. Of course, the CDC, you can also have in your phone. And that's a pretty good resource in both English and Spanish.
Thank you so much. Thank you both doctors. Thank you to everybody who made this possible. Thank you. And I'm looking right back at the camera now. Thank you. Thank you to Miguel, to Akla, to the doctors, to my brother, my son for being quiet. Thank you to everybody who tuned in. So yeah, I just want to end on this note. Like, look, at the end of the day, like everybody said, it's like, I don't want none of us to become crash dummies. None of my people to become crash dummies. Everybody's like let's look stuff up. Let's stay on our toes. Always look to the source. Whoever's telling you whatever they're telling you, always look to the source. And do your research. You know what to trust, what not to trust. Keep an eye out for that. Keep an eye out on your people that are already taking the vaccine, that are already like giving info back. And I just say just stay like that is like that. Like I'm not saying anything else but staying informed, make informed decisions. You already know I want nothing the best for everyone. I love y'all. Thank you so much for tuning in, and I will see y'all on the next one. So resources, look out for the resources. We're gonna post a survey, after show survey on our page. So keep an eye out for that. Please fill it out so that we know if there's a difference, if there's a change. But yeah, thank you so much. I love y'all. See y'all next time.
Thank you so much.
Thank you.